Turning around failing hospitals is one of the biggest challenges facing the NHS. But now the government has a rescue plan to parachute in the best managers to the worst hospitals. For 15-year-old Amy Miller in the middle here, it's too late. She died from a brain condition after staff at Basildon Hospital missed several opportunities to save her life.
We was pushed from person to person and there was no answers. It was just excuses, notes were missing, and it's really hard to keep going. You're upset and you've lost something so precious to you.
The hospital has apologised for failings in its care for Amy. Basildon was one of 11 trusts put into special measures after the mid-staff scandal. They'll now be teamed up with the best performing hospitals, just like the Superheads programme for failing schools. The hospitals will be reimbursed for their time and could get bonuses for results. The Health Secretary says good leadership is key.
Do you admit that some hospitals are now being led by mediocre managers? And if so, are they going to be sacked?
Yes, where the management is not up to it, it will have to be changed. But I think it's also worth saying that in most of our hospitals we have outstanding leadership, and we want to learn from those outstanding leaders to help us turn around the weaker hospitals.
The Queen Elizabeth Hospital in Birmingham uses technology to help provide the best patient care. Managers here will now pass on their knowledge to other hospitals.
I'm quite confident that we can see a lot of success quite early on, and I think it's, of all the schemes I've been in the health service a very long time, there's been a lot of schemes and we've known there have been problems in some hospitals for a long time. So this is possibly the one I think has got the biggest chance of success, because it's actually learning the lessons that people have already learnt and don't make the same mistakes that we made in the past.
But experts say it can't be a quick fix solution.
Hospitals are very complex, they're much bigger than schools, so the idea of adapting Michael Gove's notion of a superhead into the NHS needs to be done very skillfully and very carefully. These hospitals need support over 3 to 5 years.
The government admits it will take years to transform some hospitals, but insists patients should start to see some immediate improvements.